This meeting is being recorded.
Hey, hello everyone. I kind of confused. We kind of play at night, so we kind of say good night, everyone.
Okay.
Yeah, because it's the time we broadcast at nighttime, so it's kind of continue my programming. Okay, Bobbie gonna talk about what's the topic again?
Sensuality.
Sensuality. Okay, so let's go ahead.
Hello, everyone. This is a topic that people tend to shy away from. They don't want to talk about it. Even to the relatives of the lady that I'm taking care of, they don't want to talk about it, but it's something that we need to keep in mind. Just because the person has dementia doesn't mean that they have lost their senses. And their sense of touch is something that's still very prevalent in most of these people. When you're bathing them or you're working with them, dressing them, you still need to be aware of touch. Touching in certain places can cause all kinds of arousal or any type of sexual connotation, and you don't know how that client is going to take it. So you need to be aware of it. Even with me putting lotion on her legs, I have to be very careful. I take large strides on the legs instead of spending a lot of time with little applications. Especially if you have to touch any part of the genital area with bathing, that can cause an arousal. You still need to be very careful. You need to watch them from time to time, because there will be times when they'll put their hands in their pants, and you're wondering, do they just have to go to the bathroom or whatever? It may be their own way of taking care of their sensual arousal. These are things that happen. They're natural. You don't need to panic about it or get upset. But we do have family members that say, oh, I rebuke that. I don't like that idea. I don't want the idea of my relative, being sexually aroused. Well, especially if they're an adult, and especially if they have been sexually active in the past, it's going to happen. So don't get nervous or upset about it, and don't make them feel that they're doing something wrong. Be very careful about yanking their hand away or scolding them. That is not the way to react to it. But just try to make them understand that, okay, we're going to work through this. Everything's going to be fine. In the case of my lady, she has this, especially in the shower, she will play with herself. And, I give her the extra few minutes in there. I don't worry about rushing her through the shower. If that's what she wants to do right now, and if that makes her feel good, that's fine. But then I'm very careful then when I'm drying her after I take her out the shower. In most cases, I will sit her on, I think I mentioned this in bathing, I sit her on the toilet with a towel on it, and I ask her to dry herself. So I just say, dry your arms, dry your legs. I let her do it as opposed to me doing it, especially if I've seen her actually playing with herself. I don't want to cause any more sexual arousal if at all possible. The thing about it, there are different things that can cause it. It could be the clothing that you put on them. So be careful. If there's something that's feathery or that has a soft touch to it, that may cause on their arms or whatever, their neck. Everybody has different touch points. So just be careful even with the clothing that you put on them and how you put it on them. So again, putting lotion on them, take the large strides of just putting the lotion up, down the leg and be done with it. Don't spend a lot of time rubbing the legs with it. We know that you do have to lubricate with lotion or whatever, because the older they get, the drier their skin is. So don't be afraid to touch them, but just be aware that it could cause a sexual arousal. If it does, again, don't get upset about it. Just take it in stride and keep going on to whatever it is you were doing, basically to take their mind off of what's happening. So the reason I bring it up is because, like I said, I have family members, oh, we don't want that to happen to, no, we can't afford to take care of that kind of situation. If something should, no, don't get excited about it. It's just natural. It's nothing that is alarming. It's nothing that's going to hurt them. it may even calm them down. You never know. It may be a way, if they are sexually aroused and they're taking care of it themselves through a type of masturbation, then that's their form of relaxation. Don't make them feel like they're doing something wrong. That's the most important thing I could say, is that if you yank their hand away or you scold them or whatever, you're going to make them think that they've done something wrong. And that could even be more detrimental to their well-being. But do you have any questions about that? Because like I said, it's not a long subject.
Because like I say, I haven't done with adult caregiver for years. So my main word is just shower him. So it's like he's male. So like when you talk about touching and sense, I just feel like, you try to not let him feel. Even sometimes you joke about it. It's just like,
Right.
In a way, sometimes people just feel like they can joke, but even they cannot really, in a way. But he's not really, like you say, find like embarrassing or to talk about it. But sometimes people just joke about it to like it kind of slightly passing through, because I think that somehow is gonna be a challenge for caregiver too, because if you are the family caregiver, like if you're husband and wife, that's kind of usual, right? But like father and daughter and mother and son, that kind of relationship is kind of little tricky, because a lot of people thinking, is that appropriate? In the culture, people like, and not supposed to do that or things like that. So I think in a way, people had to find. I think it still had to a mindset. It's like just a word.
It's a mindset, right?
It's a mindset. So for me, I just feel like it's a word. I don't feel like it's kind of made them feel in a way, even then kind of joke about it, but it's he's just joke about it. That your client is not just gonna. And then of course you're gonna still steer away to make them to do something else. So you don't want to keep focusing on that subject.
Right. You don't want to focus on it. Like I said, if they get an erection or they find that there's a sense of arousal, you can play it off. Don't make a light of it. Just make them understand it. Okay, I understand. And keep on going to do whatever else that you were doing. That way you don't have to worry about how you're feeling, because in most cases, the caregiver that's more embarrassed. The caregiver is more embarrassed. So don't let that bother you. Just keep on. If you're bathing them, bathe the other part of their body or whatever, and just keep moving on. But don't let that upset you or it cause you any anxiety, because like I said, it's natural. It's nothing that you can do anything about. It's just something that comes natural with the human body. And I wanted to bring it up because, like I said, there are people that get very embarrassed about it.
Right.
And
it's a couple of videotape about those kind of. It feel like they are like maybe they just maybe a new nursing, like they just maybe intern, and they kind of have the client would be, if it's a male client, would talk to them. So it's more like try to calm them down. If what have you ever like? I don't know if you ever heard that your position is like is a male, is a dementia male patient is toward you with this deep sexuality. How did you handle it?
Well, see, like I said, I've never had a male patient. All of my patients
that's why
have all been female, but I have talked to other people. And like I said, if it happens, you don't want to bring a lot of attention to it. You let the client just work through it themselves. And as I said, if it's a case of just letting them masturbate, then let them do that. But don't make a big issue of it. Just keep on going on. If you were bathing them, now maybe then you're gonna bathe their back, or maybe you say, oh well, wait a minute, I didn't wash your face, or whatever. Change the subject a little bit, but don't make that a big issue, because then that, like I said, can cause more problems in the long run, especially if they start to feel embarrassed about it or feel that they've done something wrong.
Right.
So the best thing to do is just kind of ignore it, or as you said, play it off, kind of laugh it off or whatever, and change the subject, go to something else. Um, in my case, like I said, when she, okay, wait a minute, you didn't wash behind your ears. Come on, let me wash your ears for you. Or I said, oh, wait a minute, let me finish shampooing your hair. So, and then even to that, I have to be real careful, because for her, she loves to have her scalp massaged. And I've noticed that, you know, she'll start that moaning and all. I'm like, okay, so I stop and I go ahead and comb her hair and finish combing her hair out. So you just have to be careful and just be observant of what's going on and what their reactions are to your touch to them. You don't want them to think that your touch is causing the arousal. So if you find that you're touching them on the arm and you find that that's causing the arousal, then maybe this time instead you just hold their shoulders or something different. You'll play with it until you figure out what causes the arousal, and then that way you can avoid that situation.
Have you talked to any other caregiver about this kind of subject? How do they react?
I had, like I said, not talking about a male. So that's what I said. All of my clients, plus the people that I talk to, are all working with females.
Oh, okay.
And I think that's mainly because if you know the statistics, it's more women that get dementia and Alzheimer's than men.
That's true.
So it's just that most of the people we're dealing with have women clients because there's so many women with dementia.
Yeah, exactly. You know, I just saw the statistic for the population in the city of Concord and city of Charlotte. They are over 50% is women.
Yeah. Yeah, it's over 50%. That's what I'm saying. It's always more women. So you don't get as much feedback about what goes on with the men, because you don't hear that, because there are not that many men or caregivers that are talking about men clients.
That's interesting.
But that's something that I can check into. Like I said, I haven't dealt with any, but I can check into it and I can find out and get back to you and let you know.
Okay. I want to kind of go to a couple the different types of dementia. You are working with a young onset, like your current client is, and then you have an aging client. Like, have you dealing with any Lewy body dementia patient before? That's really a very difficult to deal with.
You're talking about like younger ages?
No, Lewy body dementia. You know Lewy body dementia, right?
No.
Lewy body dementia is more like a Parkinson. They not just memory loss, but they also have a difficult walking, lay down, down to life. Sometimes some people do, some people don't. Some kind of like motor function.
You know, the lady I'm working with now is very active. I mean, she can shower herself. She can, you have to help her with the dressing because she can't pick out the clothes and stuff, but she knows how to pull the pants up and zip them up. And you just help put her arms through the shirts. She's very self-reliant. She can do a lot of things herself. Where when I had full-blown Alzheimer's patients, they couldn't do anything for themselves. So I had to do everything for them, including feeding them.
Are they the stage 4?
Pardon?
Are they in stage 4 kind of patient? You say full-blown?
Yeah, they are full-blown Alzheimer's. At that point, they have no recollection of how to do anything.
Okay.
So once it becomes full-blown Alzheimer's, they completely shut down. They have no idea how to do anything. You're basically doing everything for them. With dementia, there are different stages. And at that point, you know, there are stages where they can still do for themselves. But there are certain stages where they get upset if you try to do something for them. Like in her case, if I try to zip her pants up, she gets very upset. She wants to do it herself. And she wants to fasten them herself. Well, we've kind of been laughing about it since I've been here cooking and all for. She's gained weight. and I thought, your pants are a little tight. You may want me to work with trying to get them buttoned, but she wants to do it herself. So I let her do as much as she wants to do herself. If she wants to try to, you know, fasten her clothes, my biggest problem with her fastening clothes, they're usually fastened crooked. because she'll start with the wrong buttons. So then
Right.
they'll be out of alignment. So I try to at least start the first one for her, and then she can button the rest of them herself. She does have problem with snaps. If I have something that snaps, she has a little bit of a problem with that. But there, as I mentioned before, there are different things that you can use, and I think that's what I'm going to do for next week, are the different little items that you can use to help them with their mobility skills.
Okay.
Yeah, but right now, yeah, like I said, the difference is the stage of dementia they're in, and that will determine if they're just starting the onset, they're going to be able to do a lot for themselves. And back to the word sensuality, there's going to be a lot more sensuality because they're still just going into it. If they've gotten to stage 3, going into stage 4, it's probably something that's going to be recessed in the back of their mind, and they're not even going to think about it.
I see. We are talking about either gonna be a dementia-friendly community or dementia village. What do you think about that? Just your
A dementia village.
Yeah.
Well, there's some facilities similar to that. There's one on Park Road in Charlotte that they have the dementia. It's a dementia building, but they have different colors depending on the stage that they're in. So if they are, let's just say the color blue is stage 1, they'll paint on the floor, there's a trail or like a little road that they know that blue goes to their quadrant, because there are 4 quadrants.
Right.
And so I like their concept. When I used to inspect assisted living facilities, I really liked their concept of having the quadrants, so that those who weren't as incapacitated could find their way back to their room. They could do these things on their own without help from a nurse or an aide. Where those that were at stage 4, they needed more assistance. So that's where you knew you had to place more of your help. And I really liked the way that they ran that particular facility on Park Road. But yeah, an Alzheimer's type village, that would be great.
Yeah, because I think France has already built one, and I think the Denmark had built one already, because I think she has Denmark was the lady, she's been in the mental facility for a long time, and then she's just expanding the idea, because inside they have everything. Everything we have outside, they have inside. So I just want to see what you're thinking about. I think is any possibility for entire stage you'll be able to by yourself and still living in a community friendly setting, because you mentioned about stage 4, they cannot pay themselves, they cannot do anything. That what is the possibility for them to live at home, because they basically it's a vegetable, they do it in a way.
Yeah, well, I had wanted to open my own facility several years ago. I had found a location, I found the building and everything, and somebody else decided they wanted to buy the building and they had more money, so I couldn't get it. But mine was going to be an all-in-one. Basically, one side was assisted living for those who could basically take care of themselves, and they could subsidize their rent by working in the facility to help the others.
Yeah, that's a good idea.
And also off to one area was going to be a daycare for children. And if they assisted in working with the children, they could actually subsidize their rent that way also.
That's good.
Because we found that children help keep, just like I tell, children help keep me young. So you put children with senior citizens.
The Japanese do right now. They put a daycare and they put a children daycare and adult daycare together.
Right. And it really makes a difference, because the children help keep the older people young.
Exactly.
And the older people help as assistants to help watch the young ones. So it's a win-win situation, and that's what I wanted to have there.
Oh,
Plus,
I will send you that video, because the Japanese already done that already.
Yeah. Plus, I wanted to have a clinic on site, but it also would have an outside door so that it would be open to other people other than just the people that live there. That way, the doctors and nurses, they made their money primarily off of the residents there, but they could also make money from the other people coming into the clinic. And then it also, to the back, was going to be a garden where they could come out and they could work in the garden, and they would actually grow a lot of the foods that would be cooked and cooked right there.
Right.
And then off to the far side would be a small kennel for those who wanted to bring their dogs or cats with them. We would not allow them to keep them in the rooms with them, but they could go to the kennel and visit their animal, take them out walking and all, on the premises anytime they would like to. We found that, you know, animal therapy is really great for them. So if you take an animal away from them, that tends to hurt them. So there would be a small kennel there where they could bring their animal, their cat, their dog, their rabbit or whatever with them, but they would not be able to stay in the room with them.
Interesting.
But see, a lot
Your
of the
concept is
assisted
very
living
similar
facilities,
to the one that gonna build the senior housing there.
yeah, well, see, some of the facilities in Charlotte, in the area, allow them to have their pet in the room with them. And that's something I don't like. When I used to do my inspections, it used to make me angry because sometimes there would be fleas. There would be some of the residents weren't, yeah, some of the residents weren't taking good care of the animals. So there might have been feces in the room and they had to be cleaned up. And so I want them to understand they could have their animal, but they couldn't have the animal in the room with them. Right.
Not inside.
Yeah, they'd be on site, but they would be in the kennel, and they could go to the kennel anytime to see their animal during the day and take them out and play with them and take them for walks and all, but they had to put them back in the kennel when they went back to their room. So like I said, I had this place all lined up and I was all excited about it. And somebody had more money than I did, so
But I think you can help other people to create their project, because I think Teresa had mentioned she know you very well. Teresa is building something similar, but it's not entirely. So hopefully we can talk about next time about what is the future village or community friendly later. Thank you so much, Bobbie, for the information. I'll see you next week.
You're welcome. Okay, take care.
Okay.
Bye-bye.
It's kind of interesting today. We talk about the either community friendly or the dementia village. These two are a little bit distinguished. Is community friendly is you living in your own house, and the dementia village you're living in the village itself, and then have everything in it. And it's just the gate system, so you will be able to inside the village itself, but not go out after the village. So where you at, so people can still find you inside the village. But community friendly, you are living in your own, everything's on your own. So if you somehow missing, and if your loved one didn't locate you in time, or somebody just wandered off, and I know a lot of video I see, like a French, China, they try to find a loved one after they wandered off, and some people took 5 years never find their lost family. So it's really sad tragedy sometimes. So I think dementia for wandered off, it somehow everybody's own major concern, and that's something we had to consider. Whatever available is it fits for every individual. So everybody's different. Next week, we're going to talk about future house, and it's going to be a very interesting topic, and look forward to share our information. And thank you so much. Hopefully, we'll be continuing to talk to reach out all our dementia recording from our number 1 high and C, number 2, and we have up to 7 today. Look forward to see you soon. See you next time.